You know, there may come a time in your or someone you know's life that you might need some rehab work, you know, whether it's for surgery or just, you know, having some aches and pains you just can't get rid of, and your doctor recommends someone, you know, to give you some rehab work done. Well, we have had in the studio many times in the past community rehab here in Gulfport, but we decided we wanted to come on location and visit with them today. Jessica Matthews, how are you?
I'm good, how are you?
You are the Community Outreach Coordinator for community rehab, and you have actually a few different locations here on the coast.
Yes, today we're here in Gulfport, and at this location we offer physical therapy as well as speech therapy, aquatic therapy, and dry needling. We also have two other clinics, one in Pascagoula on Market Street as well as one in Diamond Head on Leisure Time Drive, and they also offer aquatic therapy and speech therapy at our Diamond Head clinic. We're also opening a clinic in Mobile.
Oh, really? Okay. Now, I do want to mention, too, that the one located where we are on Community Road is right behind the theater. So if you're wondering where it is, I can't remember the street right
Community Road and David Street.
There you go, Community Road. So what if you come off of Highway 49 going back east, just after you pass Garden Park, it's going to be on the left-hand side. Now, I mentioned that, you know, you might need rehab for work, whether it's surgery, but a lot of people, they might need just a tweaking, so to speak, because not necessarily with surgery, but they've got those little aches and pains, right?
Absolutely. One thing I want everybody to know that I always tell people when I'm out in the community is you should treat a physical therapy prescription just like a drug prescription. You can take that to any pharmacy that you would like to have it filled. You also can choose the therapist of your choice that you would like to use. So I think we're really convenient, especially because we have several different therapists with different specialties, and we have aquatic therapy.
Now, what type of different therapies do you work with as far as, I mean, what, knee replacement? Met a gentleman here earlier, we won't say his name, but we met a gentleman here earlier who had some knee surgery done, partial knee replacement, but I'm sure a whole lot of things that you work with on, you know, working with people. Absolutely,
and we have many different therapists here who all specialize in different things, and Lindsay, who you'll meet in a little while, is really great with hands. We have therapists that specialize in, like I said, doing aquatic therapy and dry needling, so very wide range of specialties.
Now, if again, if someone goes to the doctor and they recommend going to, you know, getting some rehab work done, they give you a paper that says here, basically it's a prescription.
Correct.
Almost like you're going to a pharmacy. So they do need to have that to come to you, but you know, you like for them to come to you, even though they can take it anywhere, but you like for them to come to you. And I've met these folks, been known them for a few years now, and they're great people. So, but they can come to you and I guess call and make an appointment?
Absolutely. If they have an order for physical therapy, they can go to any therapist of their choice. And obviously we would love for them to come here. And most of the time a physician will either send the order over, or the patient can ask for a copy directly and bring it to the clinic of their choice. Wonderful.
Well, you mentioned that you have one of the things that you do is the aquatic type of physical therapy. So right now we want to go talk to Lindsay and head out to the pool. Well, you know, we're here in the pool area. We see a lot of physical therapy work done in the pool, but we're talking to Lindsay Bird, who's one of the physical therapists. How are you?
Hey, good to see you.
It's good to see you. Now, tell us a little bit about, as far as physical therapy. You know, a lot of people think it's just for people following surgery, but not necessarily true.
That's right. Although physical therapy is considered to be really beneficial for post-surgical recovery, we also treat patients that have balance deficits, problems with gait. We help decrease risk for falls, and as well as education and joint protection strategies to help with repetitive stress injuries like your carpal tunnel syndrome, tennis elbow, as well as chronic conditions like low back pain as well.
Okay. Now, and also talk about the age range. It's not necessarily, you know, people think, oh, you know, they're having rehab work. They think more older adults, but that's not necessarily true either.
Not at all. We see patients, the whole spectrum. We have pediatric patients that we get in the pool. We also see elderly population, the geriatric population, as well as our athletes. The whole spectrum. We can be
one range to the end of the gamut to the other.
That's right.
What other things can you tell us about physical therapy?
Well, physical therapy, you know, traditionally we think of it as a land-based approach, but the aquatic environment is also very helpful for recovery. The water offers hydrostatic pressure. which is a unique kind of thing. It compresses joints, compresses the muscle, skin. It also dulls pain receptors, so we can stretch a muscle through full range of motion, and it offers a constant resistance the whole time you're in the water versus just your exercise on land.
Now you find out whenever you're in the pool that you exercise muscles that you didn't know that you had.
That's right, and usually you find out when you get out of the pool.
I didn't know that hurt so bad whenever I did that before. Okay, well, another one of the great things that they offer here is dry needling. So let's find out more about that here at Community Rehab in Gulfport. Now, Katie Fulgham is another one of their physical therapists here, but she specializes in one particular thing, and that's needling. And tell us about the technique of needling.
It's dry needling, and it's a treatment we use in physical therapy to focus on trigger points in the body and in the muscle. We use acupuncture needles, which we use into the muscle belly right when we have trigger points or kind of knots in the muscle that are very painful. What those knots are actually contracted muscles that are stuck together and lack blood flow. So the needle, when it goes into that trigger point, it releases the muscle contraction and increases the blood flow, also decreases the pain.
Wow.
So it can be used with all kinds of different conditions, whether it be neck pain, back pain, different tendinitises, rotator cuff problems, arthritis, fibromyalgia.
I would think that would be a really big thing.
Yeah, neurological, chronic pain syndromes, RA, any immune kind of syndromes as well. We've seen a lot of great results with it.
Now, would you mind giving us a demonstration on this young lady here?
Yeah, we've got MJ here. She's laying down. A lot of our problems, a lot of the problem spot is right in the trap here, which is common with any postural problems, people looking down at their phone all the time. It's an overworked muscle.
Do I need to hold her down?
Yeah, she might jump off the table, who knows. But usually I'll just kind of palpate for the muscle trigger points. We found one right here. We'll put a needle right in there.
That was it.
And that's it. Usually you'll have a little bit of a twitch of the muscle. I'll keep the needle in there for about 10 minutes to let the muscle relax around the needle, increase the blood flow. And the patient will lay here comfortably, and then we'll take it off and also do other kind of therapies with her.
I think she's snoring.
Very relaxing. That way the patient can relax. They don't have to see the needle if they're afraid of needles as well. Usually we end it with either some massage or modalities, things like that, to help make the patient comfortable.
Well, acupuncture has been around for centuries. I mean, it started out over in Japan and all that. So I imagine it's just something that came over here and it's a great help. Thank you so much for some more information. If you'd like some great information about Community Rehab, the number's on your screen. You can give them a call. And as we found out earlier from Jessica, they have several locations and a new location over in Mobile. Matter of fact, you do have to get a prescription first from your physician. So it doesn't necessarily have to be from some surgery that you had. Maybe you just got some aches and pains, but they can take care of you. Community Rehab.
That's right.